To another wonderful episode of Iron Port. These days I've been swerving you small and I change from one studio to the other, so you're likely to see that quite often as and when it becomes necessary, so don't be surprised. This is still Iron Port, your authoritative maritime program on national television. The program is proudly brought to you by the Ghana Ports and Harbours Authority, the Ghana Revenue Authority, Goyle Company Limited, and Serene Insurance. So today we are going to talk about COVID. Because we are noticing some rising cases in COVID-19. We want to analyze the effects on the sea trade. We want to look at how people are seeing this whole rise within the ports environment, how people can take good care of themselves within the port environment. Our trade is key. The more healthier the people within the trade environment is healthy, the better it is for everyone else. That's why this conversation is very crucial. We're also going to know a lot more about the borders, the sea borders. Of course, we will also learn a little bit about the land borders, because some of the port health officials who work within the port environment are doing some wonderful exercise for the country, assessing the borders and see whether it is about time that the president announces the opening of those borders. We'll be hearing from the port health authorities in this episode. There's good news for the Ghana Revenue Authority and all of that. Let's go for a break. When we come back, we'll tell you a lot about that.
Every now and again, Goyle makes good things happen. This time, Goyle has introduced Super XP Ron 95, a higher grade fuel loaded with additives and yet sold at the same price as normal fuel. Goyle Super XP Ron 95 enhances engine performance like never before. It maintains the engine by keeping it clean from carbon deposits. Goyle Super XP Ron 95 is designed to burn slowly and thus improves fuel economy, making you save money after several kilometers. Goyle Super XP Ron 95 gives you a smooth driving experience, that is, less vibrations. Fill up with Goyle Super XP Ron 95. Now there's no need to pay more for any higher grade fuel. Goyle has that sorted. Goyle, good energy.
Electricity, pay your taxes. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Talga, my money too small. Why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is. You still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
Oh, how are you?
Hi Yvonne, a few words please. Everyone is talking about the fire at your production house last week. How are you holding up? Has production stalled?
No, not at all. My crew and everyone on my set is perfectly fine because I insure with Serene Insurance. As a matter of fact, I've had all my equipment replaced, including the vehicles that were affected. My workers have been sorted out. Even my production downtime has been covered, so it's all good. I have a meeting to attend to, so I have to get going. Sorry about that.
Which insurance company did you mention?
Serene Insurance, the new face of insurance, a member of First Sky Group.
Welcome back to the program. It's Iron Port, and as I announced before the break, the Ghana Revenue Authority has raked in quite significant, and they have exceeded their target for the previous year. That's 2020. Let's take a listen.
The Ghana Revenue Authority exceeded its revised revenue target for the year 2020 by 6%, which is also a 3.3% increase over the same period the year earlier. The authority collected 45.338 billion Ghana cedis for the year under review, as against a revised target of 42.7 billion Ghana cedis. This amount is in excess of 2.6 billion Ghana cedis of the target. The acting Commissioner General of the Ghana Revenue Authority, Ameshadai Owusu-Amoah, disclosed this at a media soiree in Accra. The media soiree was meant to deepen the cordial relationship between the media and the Ghana Revenue Authority, as well as update the media on developments at GRA. He said the GRA's initial revenue target was 47.25 billion Ghana cedis, but mid-year it was reviewed to 42.7 billion Ghana cedis as a result of the impact of COVID-19.
Somebody will question and say, in the COVID era, where people are struggling with their businesses, things are tough, how do you able to collect such revenues at a particular time? One of the things I want to say is that there are areas of the economy that we strategically analyzed and realized that they were benefiting from the COVID issues. So, for example, the telecom sector.
The Commissioner General of GRA said the Customs Division of the authority saw a 4.5% year-on-year increase, where the division was taxed to collect 10.9 billion Ghana cedis, but exceeded that by arriving at 12.6 billion Ghana cedis. He said, despite the challenges during the introductory stage of the ICOMS, the customs management system has in the longer run played a significant role in contributing to exceeding revenue targets.
And in fact, if you look at between August to December, we were doing an average of about 1.3 billion, which is about, whilst at the same period last year, we were doing an average of about 900 million. So it means that since the implementation, we have seen about 300 million monthly increase in revenue as far as customs is concerned.
Ameshadai Owusu-Amoah said his outfit will continue on its action plan to enforce tax compliance, which has contributed to the improvement in tax collection. He urged taxpayers to voluntarily comply with tax obligations to help the nation acquire sufficient funds for national development.
The authority wishes to let all taxpayers know that we need to comply voluntarily, because it is not pleasant, and we don't usually like to use the enforcement measure, but if the people are not comply, we'll be compelled to use that method.
The GRA boss also urged the press to ensure reports relating to the Revenue Authority accurately reflect events and development of the institution.
Welcome. We say congratulations to the Ghana Revenue Authority for being able to hit their target and even exceeding that. We wish them well in the coming year 2021, in the year that we are 2021. So congratulations once again to the Ghana Revenue Authority. In my studio here, I have Mr. Gideon Lamte. He's a Senior Medical Laboratory Officer, Consultant Medical Laboratory Scientist, Ghana Ports and Harbours Authority. Mr. Lamte, good to see you, Gideon.
Good to see you too.
I've dragged you here after 1 year. You're still looking strong. I'm happy to see you.
Yeah, I'm also happy to be here.
Also in the studio is my own man, Dr. Kisid Dompre, Senior Medical Officer, Clinical Care Lead at the Ghana Ports and Harbours Authority. Dr. Dompre, pleasure to have you.
Same, Machinko.
Okay. And joining us virtually is Head of Port Health, Ghana Health Service, Tema Port, Mr. Raphael John Mafo. He's joining us virtually, I think, from the Western region. Mr. Mafo, if you can see us, can you give us a wave? Good, yeah. Good to see you.
Welcome.
Pleasure to have you on.
Thank you very much.
So where exactly are you now? Where are you? Am I right to say that you're in Western region?
I'm in the Eastern region, specifically Kibi.
Oh, Eastern.
I'll be back to Accra tomorrow morning.
Okay, good. Yeah. Good. Chibi, pleasure to have you. Then let me start with you. What exactly are you doing around there? Because I heard sometime, I think last week there, about that your outfit is taking a look at some border assessment issues and then advise the executive accordingly on what to do. What, if you can brief us on that?
Thank you very much for the opportunity, and good evening to your cherished viewers. Yeah, what we...
Okay. do I have a challenge with Mr. Mafo? So we're dealing with the rising cases of COVID-19, and we're taking a look at the effects on seaports as well as trade. And Mr. Mafo, who is the head of Port Health, Ghana Health Service in Tema, that I was speaking to not long ago, is assessing on behalf of Port Health and the Ghana Health Service, assessing the borders of Ghana and advise government accordingly on possible reopening and all of that. We'll be looking at that. We'll also be looking at the what we have heard about the strains and all of that
when the
to see
president
whether
or the
there are
state
new
begin to open the
variants
points
as
of
we have
entry,
heard, plus many more. So, Mr. Mafo,
then
if we have
we
you back.
will be ready to go. So what we have been doing is that we started from the 6th of this month.
Okay.
We called all the heads of departments of the Port Health, the Regional Public Health Directorate, the District Health Directors to an orientation at the Iraqi Hotel.
Okay.
To look at the Public Health Emergency Response Plan, to look at the standard operating procedures and the protocols that we are putting in place. This is to ensure that when they go back, they will bring stakeholders working at the points of entry to be in sync with whatever we want to do. Currently, we are also trying to go around the country at the point of entry to do what we call assessment of points of entry to see how ready they are, the gaps inherent, orientate the staff with the other stakeholders, and ensure that when the borders are open, everybody will be ready to go. One of the key things we are looking at is the line listing of travelers that will be entering into the country. When we say line listing, we're talking about the passenger manifest by the transport operators. Let's take that maybe STC coming from Lumen. You have a line list of the travelers on board his vessel or on board his bus, where they are coming from, where they are going, and their contact numbers. This will help in-country surveillance for easy contact tracing. Should we even open the points of entry with time? So that is one thing we are beginning to do now. The other one is to intensify what we call enhanced screening and surveillance at both the port and the airport. This is to ensure that data from the seaport and the airport carry enough information that we need to be able to do in-country contact tracing when there is the need. The third one is disinfection of the ports, that's the seaport and the airport. We have enhanced it that the vessels coming into the country, if we have any health risk, we do 2 disinfection. One before the health risk is taken, and one, the last one after the cargo have been taken off the vessel. The next one, we're trying to also ensure that there's adherence of hygiene protocol by all the port workers. And we're trying to echo the health education we gave the port workers in January to March last year. We're trying to go back to it this time round, and the emphasis will be on hygiene and ensuring that the protocols that we set at the point of entry are strictly adhered to. So these are some of the things the Ghana Health Service and its stakeholders, with the support of the WHO, we're trying to do. At the end of the day, we want to ensure that we get everybody entering into the country, the data on the person, where the person is going at the last end, so that we'll be able to detect any place from where it's coming from till the last person. So to put it short, that's what we're trying to do at the moment.
Okay, Mr. Mafu, we know that the airports are open to passengers. Can you confirm or otherwise to us if the seaports are also open to passengers?
Fortunately for Ghana, our seaports are basically for cargo handling. Okay. So So the people who come in are crew, what we call crew change. That is what is happening at the seaport now. And from September to date, we have a protocol in place for crew change.
Okay.
We have a team, that's the COVID-19 team. So within 72 hours before your vessel enters into the shores of Ghana, you must give us the list of crew members to board. And the crew that needs what we call disembarkation. Yes. So when that is gotten, it goes through our process where the lab team from Gapua Clinic will be ready. So the moment the vessel lands, Gapua Clinic goes in to take the swab and send it straight to Noguchi. One of the vessel will still be at the quarantine anchorage.
Okay.
Until the results come and it's positive and it's negative. Let me put it that way first. Then they will be released, come ashore, and then there will be that exchange. Meanwhile, those who are coming on board to take over the vessel would have also gone through the test and would have been in a hotel of a choice. I wouldn't want to mention a hotel here.
That's
and
fine.
they will also be under monitoring.
Okay.
Once they are also negative, then the change goes on smoothly.
Okay.
So that is what is going on here. And it's strictly under the protocols we developed as far back May 2020 between the stakeholders and the crew and the vessel agents. So the port authorities are all aware. The Gapua clinic is also involved. So it's a team. We are working as a team.
Okay.
At the end of the day, when the vessel lands, they will bring the crew list requesting for the change of crew. Just to cut off, it and then give it back to indication that they have gone to the they be allowed to embark or disembark. So that is what is happening. Even more rigid than what is happening at the airport.
Okay. We will even show some of the videos of the crew changes and even the folks who go onto the vessel and get some of these samples in the course of the discourse. But let me just ask this quickly from you before I move to Dr. Dompre in the studio. Per the little surveillance that you have begun with so far, against a lot of calls by many that we have a continental free trade that has just commenced in Ghana from January 1. It is about time that we open our sea borders and our land borders to passengers as well. Is this something that you would recommend?
For now, let me say that until we put all the measures I told you earlier in place,
yeah,
it will not be prudent to open our borders, especially our borders now.
Okay.
We're trying to ensure that all stakeholders will be in sync with the protocols we put in place.
Okay.
You know the porosity of our borders. If we don't put measures in place appropriately, we may be when we open the borders immediately. I would advise that we tread cautiously once the necessary measures are being put in place by the Ghana Health Service, Public Health Division, and the WHO to even bring all stakeholders to be addressed with the public health emergency response plans that we put in place, the standard operating procedures and the protocols. Because as I speak to you now, most of the ground crossings, we are identifying health facilities where they will now link directly to report if they should get any health issues at the borders. Remember that there is a case at our border. Quickly, it must go to the Aplao health facility. Which are the health facilities? Government designated one. You go to Lungungu, it must be the same. So we must bring all this and the stakeholders, the doctors, the clinical nurses, everything must be ready. We should even have isolation facilities within these health facilities at the point of entry, so that if we should get a case instantly, the ambulance can evacuate the person from the point of entry to the designated point based on the protocols we have underlined. Else, we would rather be not doing the state any good by just allowing anybody in just because we want to open for trade.
For trade.
We have waited for some time. Let us consciously do what is needful, do what is right. Let every stakeholder know the role they must play at the point of entry. As I speak to you, Ghana Health Service and LCP are even mounting disinfection points at the ground crossings. They've done that for Aplao, Akanu, Segbe. They must go to Elubu and other places, just as we have it at the seaport now, where all containers, all cargo go through those disinfections. You must get a say at those places. And we are even ahead and ensuring that it is done as easy as possible. The borders are open for national trade and movement of goods and passengers.
Okay, thank you.
I think we should hold on for now.
Yes, thank you, Mr. Mafo. Let's get in the studio and continue the conversation from here. We'll definitely come back to you from Chibi in the Eastern region. But Dr. Dompre, in the studio, we're hearing a lot of reports about rising numbers when it comes to the cases that the country is recording. If you can give us a sense of the picture, truly, are we seeing that rise? Is it, we know that we are hovering around 2,000 thereabout. Now, somewhere last year, we went all the way to 30,000 and all of that. So what are we seeing? Why are we panicking?
Well, you know that as at March, that we had our first case.
March 2020.
Exactly. We started recording rising cases. And then all the public health experts started their work, and there was a lot of education and all that. And you realize that after some time, we hit a bit of a plateau, and then there was a decline. But right after the festivities, right, the new year, 2021, we've seen that cases have started going up astronomically. And in 2020, even though we had a lot of cases, most were asymptomatic, some were very mild. But this time around, we see that there are lots of people with symptoms. And
I see. Is that the case? Now
yes,
the symptoms
we tend to have symptoms, and the symptoms are a bit more severe. We tend to have cases of reinfection.
Reinfection meaning that somebody
got infected last year, and
getting infected
again, this time with symptoms that are a bit more severe. And then also, unfortunately, we tend to see that there are a lot more deaths now.
Wow.
And before, we were seeing deaths amongst elderly people with comorbidities. Unfortunately, we are seeing deaths amongst relatively younger people with no comorbidities. So I won't say the situation...
Comorbidities, you're talking about underlying
conditions, diabetes, hypertension, chronic kidney disease, and the likes.
I see. I see. What really is accounting for this? Now, we're hearing that there are new variants that we are seeing in Africa. I heard that we have a new variant in Brazil, a new variant in South Africa. In Ghana, are we recording these variants? Because the last I read, it was Nigeria that they were investigating if they had a new variant. Is this supposed to mean that we are seeing a new variant operating within our area?
Well, the official information is that indeed there's a new variant. A patient has been seen, tested positive, and the patient is currently under quarantine. And from all the studies, it seems to me that the new variant is in country now.
I see. Totally new variant from what we saw in 2020.
Exactly.
That's from this patient in Ghana.
Exactly.
Interesting.
But we won't say that the rising cases is due only to the new variants. Okay. You realize that, as at November, December, cases of COVID-19 were on the sharp decline. So everybody got a bit relaxed. We stopped wearing our masks. We stopped using alcohol-based hand sanitizers, observing all the hygiene protocols. We, enjoyed the Christmas to some extent. There was a political season. So all this contributed to, the rising numbers and that we are seeing now.
But apart from people losing their guards, apart from people not sanitized and we not wearing masks. And by the way, I should say that in the room here we are fine because of the level of distance that we are observing. So for those who are worried that we are not wearing a mask, that could be the reason. Is there something that as a country we probably have also missed out in all of these, aside individual, because there was something that pushed everybody to do almost all the things that we were doing in 2020. Where did we go wrong there?
I think that, you realize that the cases started declining. And unfortunately, even though there were deaths, you see that the case fatality rate was quite low. Initially, it was under 0.3%. It rose to about 4%. Now, with the new cases and all, now it's about 0.6%. So you realize that, and there was a bit of, I would say, pandemic fatigue. We got tired of wearing masks and all that. You couldn't interact as we usually do as Ghanaians. So with the cases going down and all that, I think we began to take things a bit for granted.
And return to our old life.
Exactly.
I see. But explain to us a little bit further when it comes to this, the current situation, these whether new or old variants that we are seeing. How different is it? Are we to fight it the same way we were fighting the previous one? Because if it's a new variant, what you people often say is that the genetic sequences are different.
A bit different, yeah.
So are we supposed to do the same sanitizing? Are we supposed to wear masks? Are we supposed to... Now, I always say that in 2020, I was surprised that I grabbed it easily because I was observing virtually everything. I was wearing my mask. I was washing my hands. What are we to do different? Are we to do anything different?
I think that we need to continue what it is that we did in 2020, but we need to be more vigilant because,
would that solve the problem?
Yes, studies have shown that the new variant is more transmissible. It's about 70% more transmissible, and then also more virulent in the terms of effects it has on the human body. So, as the old adage says, prevention is always better than cure. So we need to do everything possible to prevent getting infected. And indeed, we've seen that, simple practices like washing your hands with soap and water will indeed kill the virus. Using alcohol-based hand sanitizer will indeed kill the new variant. But the only different thing that I may say is its transmissibility, that it is 70% more transmissible.
I see.
And a bit more virulent than the strain we had before in Ghana.
Interesting. I'll come back again for a few education along that line, but let me ask Gideon as well. Now, last 2020, was it around April or so that you came in? Yeah. We saw quite wonderful videos of you. You had to go on vessels to take samples of crew members here and there. I'm sure we'll be seeing some of the videos on the screen. You're still doing that?
Yeah, we're still doing it.
Walk us through briefly. What do you do to get samples?
From basically, folks? Like what the Port Health man said earlier on, it's a protocol. Yes, it's a protocol in place that is going to ensure that every crew, most of the crew change that happens at our borders, they are screened, both those that are joining the on-signers and, of course, the off-signers. So what we do basically is to receive a medical report from them. 72 hours, close like from 10 to 15 nautical miles. They have to inform the port of their medical state, whether there is anybody sick or so. They also have to give us a prior notice of whether they are going to have a crew change. They will request those details. And once they get to our anchorage, we have a place at anchorage far from the port where the vessels berth. Then what we do is to go with our launch straight to the vessel, take samples, I should say, of these crew, bring them on board, take them to the testing sites, have them done. Once they are found out to be negative, then they will be allowed to come through our borders through the airport.
Not to rudely interject, but let me speak to some of your images we can see on the screen. Describe this one for us, for instance.
This is just what I did yesterday.
Oh, just yesterday?
Just yesterday.
So you boarded that vessel?
Yes, that
using
vessel.
the monkey ladder there?
Yes, so that's me.
That's what you call the monkey ladder?
That's what we call the monkey ladder.
You're able to board it, climb it, and
right,
then get
yes,
onto the vessel?
At high seas, there.
So when you are coming back with a sample of the...
Yes, so the sample of the patient or the crew is in my bag. It's attached to me there, and I'm coming off.
So if you're not lucky and it falls into the sea,
then I'm gone. Then I'm gone. Such a risky job.
That's interesting. And you do this, how often do you do this?
I think maybe 3 or 4 times in a week.
3 or 4 times in a week?
Yes, in a week.
How different is that now from back in 2020?
Yes, back in 2020, now we were not doing crew change as often. It was basically if there is a sick crew on board, then we go. But right now, I don't know, for reasons best known to authorities, a lot of crew change is happening at our borders here. Probably the vessel owners have seen our ports as a safer place for them to do their
also,
crew
I think
change.
government has put in place quite a number of measures to get that through the Maritime Authority and all
that. To ensure that these things are carried out effectively based on the COVID-19
That means that
now
rather, you are very regular going on the vessels and getting samples.
Yes,
so
very regular.
Contrary to the general perception, others, they nationally, others have lost their guard. For you, for instance, you are doing far more than you even did back in 2020.
Exactly. And that's, it continues to be very difficult because there may be times too that is not only crew change, but there are sick crew on board. I think the last vessel that I screened somewhere last week, I had 4 positive COVID patients on board.
I see.
Yes, so we had to go and swab the entire vessel and come and run the test. We found out that there were 4 of them who were positive, and we had to go further to fumigate the vessel by the Port Health authorities. And later on, we disembarked these 4 crew to the National Isolation Centers, the treatment centers for treatment. And later on, the vessel was allowed to berth after proper fumigation exercises have been carried on for cargo operations.
When the sick crew get healed, then they return to the vessel?
Yes, of course.
Okay, so that's been the practice of
That's been the practice.
There was a problem about testing. We've heard a lot about testing. People nationally are complaining about the fact that when you samples are taken, for instance, it take quite a long time before you get the response and all of that, and it's all part of the reasons why. I will come back to Dr. Dompré on that. It's all part of the reasons why we're seeing the spread that we are seeing. You are with the lab and you've been doing a lot of these testing and all of that. Do you see the same picture, or around the port space or from the facility that you are coming, the picture is different?
Oh, no, it's not different. We have a national accredited centers here in Accra, especially Noguchi and that of Public Health Reference Lab. And looking at the loads of cases that they are running, of course, you would have them having these challenges. And there are times that samples need to be repeated, right? Sometimes the sample is taken.
You took it, you are not sure of the outcome,
no,
and you want to take
they run the test, maybe it's inconclusive, so they have to repeat the test before they can be able to declare that you are negative or positive. It's part of the laboratory protocols. You don't just tell somebody that is negative when you are not really cocksure.
Okay, so when you double or multiple run like that, who bears the cost?
It's the testing centers. So
the testing centers?
Yes, they bear
and
the
I hear
cost.
the cost is now rising, or it's risen?
Oh no, it's still, as for Noguchi, they still take what they take. That is the 350 cedis for the ones that are traveling. But for the clinic cases, they don't take money at all. They don't charge us. So we take these clinic cases to Noguchi, and they run them for us. The only challenge we have usually is with this entry system. The government had introduced this SOMA system, which is very good. They're able to track all the samples or the cases where their location is. But sometimes there's a bit of delay. The laboratory or Noguchi will run the test, but getting it onto the SOMAs, where some of us could have access to, there's a bit of delay. And that is also continuing to cause the delays in we getting the results on time.
Dr. Dompré, from the hospital or from the clinic where you sit, how are you seeing the attitude of patients when they show up, for instance, in the past or somewhere last year? People we heard news that when people are showing up and they have some small headache, or maybe they have high temperatures and all of that, nurses and doctors will be running and hiding. What's the picture now?
Indeed, that has never been the case.
Okay.
Of course, in the beginning, there was a lot of fear because it was a new virus. We didn't know what to expect and all that. But as time went on, we understood the disease better. We understood what to do and how to manage the cases. From where I sit at the clinic, in the beginning, we were seeing patients, but what we realized was that there was this fear, that once you come and you test positive, would imprison you or would make sure that you are quarantined somewhere, won't allow you to talk to your family and all that. But I guess with time, they got to know that indeed it's not something to worry about, that once you test positive and clinically you are stable and you are well, we give you some medications and you self-quarantine at home, only to do a repeat test in 2 weeks' time, after which most of our clients will be COVID-free. But recently, what we're seeing is increased number of such cases. We have people coming in with malaria-like symptoms, and you will do your initial assessment and you do your initial laboratory testing, and the patient will not be having malaria or any other illness initially. But you suspect COVID, you run a COVID test, and within 2-3 days, the test comes as positive.
I see.
So that has been the new norm now. So for people presenting with general malaise, general body weakness, headaches, cough, a bit of diarrhea, difficulty in breathing, and all that, all these symptoms, they're a bit general. But once we have a high index of suspicion for COVID and we test, most of them turn out to be positive.
That brings me to the question that, again, out of the perception, and this is because we don't have a lot of information on this particular thing. It's new to a lot of us, and we pick up some of the few things that we hear. Some say that if you have malaria, regular malaria, for instance, and you test, you are likely to test positive. The
pathogens that cause malaria is different from what causes COVID-19 infection. So indeed, if it's just malaria and you are positive, then it's malaria. But it could be that you have malaria and then have COVID on top of that.
Oh, I see.
I remember somewhere last year we had a patient like that. He came with symptoms. He looked a little ill. But when I did the malaria test, his plasmodium count was not that high. If I compare that with his clinical picture, I suspect that maybe there's something more. So on hindsight, I said, you know what, let's just do the COVID. Initially, he was a bit hesitant. But after a bit of convincing, he agreed to do it. And indeed, it turned out to be positive.
I see.
So we don't just say malaria. Now we are thinking, could it be COVID? And we screen for that as well.
But the new strains, as we talked about, and because you mentioned a particular case and more or less now confirmed that there is a variant that is different from what we had before, are we seeing different signs from what we saw back in the day? Because people are saying that now small body pain, your waist small now, then they tell you have to be careful. When I was feeling my waist pain, people were, are you getting the second time?
Well, you know that in Ghana, everybody is like a health expert or something. But I would say that we've seen that there are more symptoms. Initially, we were just having symptoms like loss of smell, loss of taste, hoarseness of voice.
Is it the same or additional
it's same with additional ones.
Like what?
General body pains, joint pains, headaches, diarrhea, chest pain, difficulty breathing. It's not specific like before, but what we've seen that tends to run through all these patient presentations is that as for loss of smell, loss of taste, most of them seem to have that in addition to these new signs and symptoms that we are recording.
What level of urgency should we attach to it when we start feeling some of these symptoms? Because in the past, or towards when we got familiar with the disease a little bit, so somewhere around May, June, for instance, you were told that once you start feeling the signs, don't just rush to the hospitals, because the hospitals were even becoming scary to get to.
That's right.
Is it the same way, or now we can just walk up to the clinics and start seeking Medicare?
Well, I would say that prevention is always better than cure. We want you to strictly adhere to the COVID preventive practices or protocols. So you wear your nose masks, you wash your hands with soap and water, use alcohol-based hand sanitizers. The moment you feel that you are unwell, of course, you call on the clinic, come in your marks, and we'll attend to you and see what we can do to help remedy the situation. We won't say that we should all be in a state of fear or we should be panicking. But the COVID disease is such that, you may be okay, you may survive, but you don't know the effect it will have on somebody that you may, accidentally infect. So we want to make sure that once you don't feel well, you call on a health facility to get checked. Let me put it that way.
The last one, then I go to Mr. Mafo on the line quickly, ask him a little bit about the numbers we are seeing from the seaports as against those we are seeing from the airports. But contact tracing, are we doing as much as we were doing back in the day, back in 2020?
Again, initially, because we didn't quite understand the disease like we do now, there was a bit more urgency, let me put it that way.
Is it not that now rather we are complacent? We think we know?
Now we know a bit more. Now we know a bit more, that's true. And of course, we know how the disease also progresses. We understand it a bit better. So we are not in the panic mode like we used to be. But contact tracing is still ongoing. For example,
as intense as it used to be.
For example, at the port, once you test positive, your immediate family is called. The people that you work closely with at the workplace are also called in and also tested, asked to go on self-quarantine, awaiting the test results. So indeed, the contact tracing is ongoing. But you know that in 2020, initially in March, April, there was this mass movement, we have contact tracers going to homes and all that.
Yeah.
But now we have a bit more information on the patients, we can track and trace. So I wouldn't say that that panicky mode, which we were doing it before, is the same approach we use now. But indeed, we still do our contact tracing.
Okay, let me reach out to Mr. Mafo quickly and then come back to Gideon. Hello, Mr. Mafo, can you hear us? Hello?
Yes, I can hear you.
Okay, so let me find out from you.
Yes, I'm on the line.
Mr. Mafo, the president mentioned that in the last update, for instance, that we're seeing quite a lot of importation of the new rise. What we are seeing now, most of it are imported and all that. Can you say that it's the same with the seaports, or because passengers are not originally allowed through the seaports, we are not recording that much from the seaports?
Absolutely. Your last statement points to that fact. We dealing with only crew. We've not had any passenger vessel enter into the country since March last year. Okay. And the crew have been at sea for over 9 months. I think Gideon was currently getting more of the. It's as a result of they having been at sea for a very long. The international maritime mandate that I've to 9 months they change, and that is what we are seeing. So we are not seeing new strains from the seaport as we. I think Gideon told you we've only had for the last month as we come into this month.
Yeah.
That is what is on the ground as compared to the airport. Because the airport people are already on the ground moving 24 hours. Here, 72 hours, we get information on the vessel coming. Track on the health risk on board the vessel. Like I said earlier, we even do what we call risk assessment of the vessel. The risk assessment of the vessel is because we take a critical look at the last 10 points of call of a vessel coming into Ghana. So if a vessel is coming from, let's say, Durban in South Africa, where we know that the risk is more COVID cases, then we now begin to put surveillance more on that vessel. So it is not the protocols we have put in place at the seaport, which is making us get the rigid results that we're getting. Fortunately, we are not getting the cases as we are getting at because they stay more at the sea, and I think it is now that doing the crew change that maybe when they come back, that's how we look. So we are now going to modify our surveillance of the sea in every crew member, as well as ensure that we detect any new strain with the lab men from Yahuwah. Actually, like, we're doing a collaboration, ensuring that everybody entering into the country from the goes to the test. Sometimes within 72 hours before they are allowed to enter the country. So we are not experiencing.
Okay, so as Gideon mentioned earlier, if you compare 2020 to 2021, because of the crew change, there's a lot that is being done as far as the testing is concerned. Do you think that it's in order that we have begun the crew change? Because we also know that around the world, a lot of people had raised concerns about how crew members had been stuck on vessels for months without attention and all of that. So hence this intervention. But do you think that we can pay dearly, or this crew change measure can cost us as a country?
Looking at the measures we have put in place, it will not cost us.
Okay.
It is rather enhancing our activities at the port, and it is rather raising Ghana higher. Station meetings, some of which we attend, they are raising Ghana high for the measures we have put in place. In 2 hours to 96 hours, the vessel is and you are screened, you take to be at the anchorage. So the person is being negative about to come to the country. You still be at the anchorage, at the quarantine anchorage, a case. All the crew members are there until they go through the surveillance period 14 days. So at least Ghana is doing something wonderful that people we are being commended by the international and at other high bodies. So I think we should continue doing what we are doing, ensuring that anybody coming in, we should screen the person must go to at the anchorage before the vessel comes ashore. We are not putting the country at risk. That other countries are trying to help.
That's good. I'm glad to hear this. And I always refer to 100 years ago when we had the previous the pandemic and quite a number of people died. It had always been referred that a lot of the infections that we recorded as a country came from the seaport. And so if this time around, and particularly in 2014, Ebola, the port recorded absolutely zero. And this time around too, we have ensured that, you know, the seaport is not a conduit to import some of these. That's a good thing to hear. I'll come to you, Gideon, on that bit, because when it comes to the testing and taking samples, when I did, I remembered when you tested me. A lot of attention comes to you. Ebosin from Zenith University College says that I am watching the program. This is a very insightful program, as always, and it educates quite a number of us. Dr. Bright Asamoah sends hello and says that I'm watching very insightful discussions, and says hello to Dr. Dompre as well. You can also send your WhatsApp messages via the numbers that are on your screen, 0559019177, 0559019177. It's on your screens. The number that you can call is 02055288353, 02055288353. Gideon, share with us the testing procedure. Back in the time, you would insert this long thing down the throat, do the same in the nostrils and all of that. Highly uncomfortable. It scared a lot of people away. Are people willing to come forth and test this time around?
No, it's still the same procedure.
Highly uncomfortable procedure.
Very, very uncomfortable. We try as much as possible to make it a bit comfortable, but any comfort to the patient might result in a negative test, which truly is a false negative.
Okay.
Actually, it could be a positive. So the procedure that we have in place, that's the oropharyngeal swab. That's where we swab behind your tonsils there, down there. Then we also have what we call the nasopharyngeal swab, where we insert down through your nostrils. And it's not painful, I should say. It's a bit uncomfortable to but right now we have quite... Of course, once you put in these
Mm-hmm.
swabs there, you trigger the nostrils, and it's a body's immune system.
But should you get tested and these two processes are not followed, can that alter the outcome of the
Yes.
test in any way?
Yes.
For instance, if you use only the throat and you don't use the nostrils.
No, the thing is that if you want to use the nose, you should be setting on the sample that you are taking. You should go quite a bit down and swab. Not just at the peripherals, no. You might miss it. That is, if the person is not even showing symptoms, you might miss it. And of course, there have been instances that we had false negative results, and actually a patient was positive. I think somewhere last year, a very sick woman, and she reported at the facility they had swabbed the first time, was negative, but the woman's condition was not improving. So I had to go there, and once I got there, I realized that she was not even willing to open the mouth to swab
because of the discomfort.
The discomfort. So I had to talk to her, even try to convince her, if possible, she can even get me phlegms, which is very good.
If you can produce a phlegm.
Yes, phlegm, not saliva, but it should be phlegm. It's fine. So I had to give her a bit of time, try to talk to her, and eventually she gave me the phlegm, and lo and behold, the test came out positive.
You see, that's bringing me, that's what I was building. I wanted to come to the point where now people are expressing a lot of mistrust, sort of, out of the testing results that are coming. Some say that, you go to, they know them. So you go to Noguchi, go to all the facilities, and the outcome sometimes it's not what exactly it is. Is that true? Somebody says I was traveling. They give me some are even alluding that you can even pay and get a different result.
It's not true. You see,
it's not true that you can pay and get a result.
It's not true. It's never ever true.
You haven't seen some.
It's not true. Looking at the systems that the testing centers have in place, it's going to be hard for you to do that. Of course, you have to be swabbed. Whoever is swabbing must take a good sample. You cannot swab yourself and take it to the testing centers for the test to be done. And of course, they have system in place to really determine whether the sample that you brought is actually a nasopharyngeal, oropharyngeal, or whether it's a correct sample that has been taken. They will know based on the results that they will get. There was this social media report that a gentleman went to Noguchi to do a test. Eventually,
there were results he demonstrated on social media.
Yes, but that was the actual results that he was given. He was positive. But
and he went for a negative one.
Well, as of now, we haven't seen the negative result that he claimed that somebody from Noguchi called him to do what? To change. It's not possible. There have been instances that even at the port, crew that we have screened them, we couldn't get the results on time because there was a repeat, there was a delay, and they missed their flight. Noguchi, I have to go and swap and take the sample again. It's not possible. In my area, in my practice, what I've seen so far, I don't think it's possible. And looking at Noguchi, they have been a top-notch testing institution way back. They have their reputation. They are internationally accredited. For such a thing to
that's good to hear. That's assuring. But you can, particularly speaking for yourself and your facility at the port, you are saying that every test that you take, the outcome is as it's supposed to be.
Yes, as it is. You know, the virus, like Dr. Dompre said, it's new. We are still learning it. For instance, you can be swabbed today, you are positive. The next day I can come to swab you, you become negative. It's all about viral load. And your viral load keep on reducing as and when you are recovering. So the fact that you are positive today doesn't mean that you remain positive, or the fact that you are negative today doesn't mean that you are going to remain negative. The virus, it takes time for it to grow into, to get to a level that the laboratory, when they test, will be able to find them in the system. So all of these factors are in place. Of course, good sample is very, very key. So like I always say, that whoever takes the sample to the testing site is very, very critical. The result is as good as the sample that is taken. So effective sample or proper sampling cannot be overemphasized.
Okay. One Juan says, thank you for the education, Dr. Dompre and Gideon. Dr. Dompre, let me find out from you again that the port community, what should people begin to do now that we are seeing this rise? What are we to expect, particularly from the health department and all of that? What is there? Should we also panic as, should everybody around the port space panic as everybody else?
Well, I would first of all say that no one should panic. We know what to do not to get or risk getting infected. So let's not be complacent. Let's not take it for granted. We have loved ones at home who are looking up to us. So let's, as much as possible, let's abide by the COVID preventive protocols. So you wear your masks, you wash your hands with running water and soap, you use your alcohol-based hand sanitizers, and then you do your social distancing. At least we know that with these measures in place, risk of getting infected is minimal. Yeah. But from the health services department, what we intend to do is to start our public education again. Remember, in March, the general manager of health services himself with a team went around all the departments and all the stakeholders to talk about COVID, signs and symptoms, what to do when you are
resuming that exercise?
Yes, so we are resuming that. And at the clinic, new measures are also taken to ensure that the poor community is safe. For example, moving forward in the next few weeks, we are going to go by an appointment system where you call in and book an appointment to see your doctor.
Okay.
And especially for people with chronic medical conditions, diabetics, hypertensive, just needing refills and all that. Of course, would be opposed to see urgent and emergency cases. One of the new things that we intend rolling out very soon is to have a Clinic B set up as a COVID treatment center for managing mild and moderate cases. Because as we speak, almost all our treatment centers are full to capacity.
I see.
And sometimes we get cases that we have a high index of suspicion, but centers are full. So we are forced to keep and manage and test and hope that the results come soon enough, while we also do all the right things to not risk getting infected. But moving forward, I think we are working together with Director General and the Directors of Port to set up Clinic B inside the harbour as a place where you manage mild and moderately ill COVID patients.
But who can assess your facilities at the port? Can the general public be visiting your hospitals, the clinic, the International Maritime Hospital, and all of that?
I mean, we are open to everyone. We just don't see staff and dependents and then members of the port community. We see everyone who walks in through our doors for care.
This one says that, and this is supposed to be who? Let me get the name right. Mireku says, I'm watching this comprehensive presentation by the doctors, the Dr. Dompre and the other man, Gideon. This is insightful. I work within the port space, but there's little I know, and it's coming from one year, Mireku, and says kudos to the doctor and the gentleman in the studio. I'm going to try and see, take short, just about 2 international news quickly. And I have to speak again to Mr. Mafu before we wrap up, just in 3 minutes. So just take 2 international news and I return.
About 750 containers have fallen overboard from a Denmark-flagged container ship in rough weather in the North Pacific. The incident occurred while the vessel was sailing from Xiamen, China to Los Angeles, California on 16th January 2021. The bulk ship, which is owned by China's Bank of Communications, is commercially controlled by Danish shipping giant Maersk. Maersk said all crew members are safe and assessment is ongoing while the vessel continues on her journey. British multinational oil and gas company BP has denounced media reports alleging the company was involved in the grounding of the bulk carrier Wakashio off Mauritius in July 2020, causing a massive oil spill. The reports claim that BP bunkered unsafe low-sulfur fuel oil to Wakashio before its voyage, causing the ship to experience engine failure. But BP said the fuel supplied fully met the specified standard that is recognized across the international bunkering industry.
Okay, so Mr. Mafu, hello. If you can hear me, what would be your last advice as the head of port health at the Tema port, for instance, and undertaking the kind of exercise you are undertaking on behalf of country? And maybe I will read you this message from a gentleman called Abukari Isa to Rapid. It is not the fault of anyone but the state institutions. That is why we are going down. Do you agree? Okay, so I think we have a bad sound. Unfortunately, we couldn't get Mr. Mafu to wrap up on that. But Dr. Dompred, what do you say to the gentleman's comment that it's not as if the individuals have lost their guards, but the system itself failed the entire country?
Well, you know that health is a personal responsibility. Your health, your well-being
should be your personal responsibility.
Yeah. I mean, the state can only do so much. So, for example, if you don't abide by the COVID preventive protocols and you say that the state has failed, then I don't know how else. Or
you should be careful yourself.
So we should make sure that first and foremost we are doing our bit. Then the state can also come in to support us.
Okay, thank you very much. So Gideon Lamte is a senior medical laboratory officer, consultant medical lab scientist at the Ghana Ports and Harbours Authority. From Eastern Region, we were joined by Mr. Raphael John Mafu. He's the head of Port Health, Ghana Health Service, Tema Port. And also in studio here, Dr. Kisi Domprez, senior medical officer, clinical care lead at the Ghana Ports and Harbours Authority. Gentlemen, thank you very much for your time and hope to see you another time. We hope that we can meet you again some other time without COVID cases. Thank you for watching.